And yeah, so I passed my exam about a year ago, and like Dr. Dure said, a lot of the challenges I faced were based on the fact that the PLAB 2 exam focuses on things that we are not used to. You know, in our own home countries, there's a lot of things that PLAB 2 focuses on that we are not used to. Without getting too technical about it, there's a part of the marking scheme in PLAB 2 that is interpersonal skills, which just deals with the way you talk to the patients. And that's very important for your PLAB 2. It takes like 4 marks. It's 4 marks for just the way you interact with the patient. So the challenges I faced were the fact that I wasn't used to talking to patients in that way. So I really had to like double down and try to understand how to interact with patients in the NHS.
Oh, okay, yeah. So that I think that is a major difficulty that nearly everyone faces. As we go along, we'll try to just incorporate all the questions that we are getting from the participants. Someone asked how many months of preparation is required to pass it in one go. I think talking about the duration in particular, it varies from person to person, but according to my experience. I think 3 months, 3 to 4 months are very safe, and maybe one is too little, two is quite reasonable. If you are kind of aware of the structure and you are ready to take all the hardship that you may have, then if you have 2 months, then forget about sleeping properly. Okay, so going back to the slides, I want you, Dr. Saad, Dr. Mike, and Dore, please add your points as we go along through the slides. Okay, resources for PLAB 2 preparation. There are multiple textbook online, GMC website, and patient info, NHS UK. There are OSCE practice groups as well. Just be careful. Do not get spammed and scammed. There are so many, which is so many on the WhatsApp, and the people, those who are running those groups, many of them have not even seen any patient at all. Many of them have no stakes at all, and they're running the groups. Just be careful. It is your right to look for the resources and make sure that whatever you are joining or doing is right for you. Okay, do not just run after the money or after the free sessions. There are multiple academies as well which are doing really great, and they are contributing a lot. So just make sure that not all the free groups all the free meetings are good. Okay, then mock exams in the simulation centers. There are multiple centers including PLAB Guide. Increasing your chances of passing. How you can increase your chances of passing? Start the preparation early, at least 3 to 4 months before. This is an answer to the question that was asked in the meeting. Create your plan, and you need to have when you create the plan, try to make a group of friends or the participants who have the exam nearly the same date or closer to that, so that you can set the target and you can set some timeline to achieve certain target, and practice with each other, and you're ready. Practice with your other study groups as well. Having different experiences is always good. Focus on the time management. Yes, this is one of the big challenge. We will talk about that. I will ask Dr. Dore to contribute and tell us about the time challenge. Seek the feedback from you on your performance. Okay, Dr. Dore, do you want to say something about the time management? So you guys are actively doing the mocks and the being examiners. So what
For the time
are
management, I think one should make a really good reflexes for how to take good history.
Mm,
the data gathering. It should be really, really efficient, and the reflexes should be nice, and they should obviously memorize the differentials and the red flags. Only then they'll be able to know what, and especially I would say that asking the specific questions, because there are certain specific questions for each and every station and then each and every category. So asking those specific questions and the risk factors. So there's so much learning involved in this
mm.
exam as well.
Okay,
So
Dr. Mike Saad and Durre, I have. It's been some time, to be honest, since I did the mock myself as a mock examiner. I do the feedback, as you know, because I'm busy with the stuff with other things. Now you see loads of candidates taking the mock. You guys are doing that on almost daily basis on. Most of the days in a week. And what are the common things that you see are failing for the candidate to achieve their time management?
Sir, I believe that because sir, people have memorized stuff. They
All
have
right,
something in their
like
mind.
scripts,
Yeah,
robots,
scripts.
yes.
Yeah, robotics.
Yeah,
Yeah.
yeah.
So, sir, what happened because they cram the notes, any
Mm.
notes they cram, and then they try to put those things in every station. For example, it is
All
very common in student like DASA, diet, exercise,
all
smoking
right,
alcohol.
okay, like the mnemonics, and they try
Yeah,
to
no,
implement
yeah,
and
yeah.
incorporate
And
the
then, sir,
mnemonics.
for that instead of asking the relevant risk factor for a particular disease, they always put these mnemonics like DASA everywhere because
All
they
right,
have
yeah,
gone through these
okay.
things in
Mm.
the history. That is why they spend a lot of time. I can give you many examples. Like in case of IBS, the risk
Hmm.
factor is stress, tea, and coffee, but they will
Yeah.
more stress on DASA.
All right. Okay. Yeah. So they try to implement and incorporate every single scenario, and that's
yeah,
as you said.
exactly. And there's one more mnemonic flaws:
All right. Yeah. Okay.
fever, lumps, bumps, and
Yeah.
appetite loss, weight loss. So they've just memorized this flaws, and they're applying flaws everywhere, regardless of the relevance of it. So that
Yeah.
just tells
That
you
sounds
that they're
really funny
scripted.
as well
So
sometimes.
basically, sir, I believe that notes, the cramming notes, is the main reason because they try to put everything whatever they have gone through, especially even in the management part as well. They have
Mm.
gone through the 1.5 page of management, and they try to force the patient to listen to that page management. So they are
Mm.
not only wasting their time, but also they become patients. Instead of having patient centered approach, their approach will shift it towards the doctor centered approach. So these are,
Mm, okay, yeah. So no sympathy and empathy.
yeah.
Yes, these are, and this takes you away when you see the patient is not satisfied. This takes you away from the time management. You end up losing a lot of time. So essentially, not following the notes. Notes are just to guide you. They should not be memorized and crammed. Okay. So excellent, thank you. That's a really good contribution. Now, going back to the slides, I just want to continue moving forward as well. I don't want to make it boring for everyone. Common pitfalls to avoid. Please let me know, Dore and Mike, Saad, if you want to add anything. The
Um,
common pitfalls are neglecting the communication skills. These should be avoided. Okay, do not neglect the communication skills, and make sure that you trust yourself and do not follow anyone else. Do not start copying the words and the phrases of others. Okay, be natural. Focusing solely on the medical knowledge is again extremely disastrous. Okay, if you just start focusing on the medical knowledge, because PLAB 2 is more about the patient safety, how you communicate. Not knowing always is not very important. Okay, even if you don't know the management of many conditions, you can still pass with very good marks. PLAB 2 is not about just telling the medical management or the medical knowledge about the investigations. It is all about how you communicate and how you deliver the information, even if you don't know. You need to have those skills. And underestimating the importance of the cultural competence. Okay, that's very important. Okay, if you underestimate yourself or the others, there is a lot of cultural differences between UK and the other developing countries. So wherever you are working, if it is not UK, even if you go to Ireland, the structure and the culture is much different in the UK in comparison to many other countries. Poor time management, we've already talked in detail, and neglecting to practice the common procedures, like when you start believing that I've done this so many times, I'm the master. Okay, that is what can kill you in the real exam if that comes in your exam. Uh, Especially if you have not practiced. The procedures are very common, like taking the blood sample, putting the cannula, putting the catheter, or maybe uh, taking the blood culture. But it is very important that you practice, because you will be under stress, you will be under the exam atmosphere, and you will be monitored, assessed, and your performance will be compared with your peers as well. So if the candidates start believing that I'm the master, I can do anything and everything, then this false belief can lead to the um, unliked outcome. All right, so additional preparation that you need: research areas near the test center. Okay, find out what is there, like what are the resources. Say, for example, knowing about if there's any obstruction, if there's any building work, especially before your exam days. Okay, if there's any problem or that you need to keep in your mind, like the protest and stuff. um, then about the accommodation, stay closer to the exam center. I mean, within Manchester, try to stay closer. Find the uh, short rental accommodations. It can be challenging for those who are sitting abroad, because finding an accommodation for the short term is not an easy task. Book in advance to secure the better rates and stuff. Okay, any if you found any accommodations and stuff. uh, about We have talked about the obstructions and stuff, any delays, possible potential delays. Consider the proximity to the study resource, whether you are going to any academy. If you are going to any academy, make sure that you stay closer to that as well. So finding some place which is closer, reasonably closer to the exam center, as well as to the academy wherever you practice, or library, that's very important. So finding a place closer to the academy, the practice center, is more important, because to the GMC you will be traveling once only, but maybe to your practice area where you will have more colleagues to practice with, you will need to travel day and night. Additional preparations and the funding. It is very expensive exam, guys. Now you will see on the day of your PLAB 1 result, when the new seats are open, or when the candidates start booking for PLAB 2, all the seats go very quick, very quick. So you need to have your funds ready, you need to have alternative credit cards and debit cards ready and everything. You might have seen that challenge, but because for PLAB 1 the fee is very little in comparison to PLAB 2, many of the banks do not release the money, especially the international banks. So you might need to contact your bank in advance and make them aware that you will be doing a transaction of about £1,000, so that they do not block. Many of the time, the problem may still exist. You might need to find someone in the UK who can help you with that, with the payment. And do not be scammed by the people sitting online asking you to give the account access and I will book for you. Do not make that mistake. They can hack the accounts and steal your money as well as information. Choosing the right academy. There are many academies, I can name them. Okay. uh, Common stations, Dr. Swami's Academy, Mosobe Academy, PLAB Guide Academy, Aspire Academy. Um, is any other? I don't think there are many other names. Yes, there are multiple other academies as well. Okay, what is important? I honestly do not want to say anything bad about it. Just do your own research. Okay, who is providing much support, and what you need from them? Do you think that you can achieve? And check the feedbacks. That's very important from the other colleagues, those who have done their exams. Feedbacks can be good and bad. Make sure that you analyze, get more feedbacks, as many as you can, and consider the faculty expertise and the qualifications. Like, there are many academies, I don't want to name. There are many academies among those that I just mentioned who have not seen any patient themselves. They are just into the business or into the academy. Okay, so they do not have that expertise. So you want something or someone who is actually connected to the NHS, who is actually dealing with the patients, who has seen the difficult patients, as well as the difficult colleagues, who has who have seen all those challenges that you might expect in the GMC exam as well. Okay, in the simulated environment. So make sure that you get the feedback, you find out. You don't want to be robots, you want to be the doctors, and you want to learn from those who have actually the real experience of that. Okay. uh, Academy, what the PLAB Guide is offering, we are offering multiple courses for PLAB 2 preparation. I don't want to sell the courses now. I just want to advise you guys. You can always visit our website. All the information is there, and you can always contact us via Facebook, WhatsApp, and stuff to get more information. Okay, our features are: we offer multiple courses for the PLAB 2 preparation. We have experienced faculty with very high success rate. Dr. Saar, Dr. Dure, Dr. Mike, Dr. Sharista, they are extremely liked um, supervisors and the tutors, and they're loved by the candidates as well. We do a lot of OSCE stations and mock exams. We are one of the busiest academy from that point of view, and we have very high standard mocks. We try to be personalized. We give them personalized feedback so that the candidates can improve on their mistakes and the shortcomings and stuff. And we have learning, flexible learning. When I say online, in person, and having two campuses, one in Pakistan and one in the UK, gives more extremely high flexibility, especially to the Pakistani candidates, because they can join Pakistan as well as in the UK. And in Pakistan, we do not have just a building. We have a tutor. We have all the mannequins, including a symbol. Okay, uh, we are nearly halfway through, guys. Okay, PLAB Guide Academy. What are the unique features? We are up to date. We stay aligned. We try to be aligned. We have uh, recurrent courses happening every week, so we always see the small groups, and we prefer to have the small groups so that we can provide personalized attention and the feedback to the candidates. Access to extensive question banks and stuff and study material. We provide them regular performance tracking. We keep asking, we keep finding out what is happening, if the candidate is facing any difficulty and problem. And then post course support and the guidance, we always open and up for that. Now, preparing for life in the UK, you need to, as we mentioned, you need to be aware of the UK healthcare system, understand the cultural difference in the patient interactions when you are seeing the patients in the UK. That will be extremely different from what you are doing in Pakistan or India, Bangladesh, Egypt, Nepal, or wherever you are. working at the moment. So knowing about the NHS, watching videos, authentic videos on the NHS website, on the YouTube, or visiting the NHS websites are very important. Okay, they can be very helpful. Just spend some time when you are free. It is good to know the place where you are going. So if you know that place in advance, that will be really helpful for you to create an idea and make your life easy. uh, Stay up to date with the current healthcare issues, like if there's any issue. So what happens in the GMC exam, many of the time, they the stations, the scenarios that they pick, many of them have are among the challenges. Like if the patient, any patient had the bad experience in the hospital, and that became the news, the headline news, then the GMC may start asking about those scenarios. Okay, so just be careful. If there's anything going on in the news related to the health care issues, they may come in the GMC exam as well. So stay up to date. Visit the GMC website as well. Okay, guys, anything, Dr. Mike or anyone else who want to participate and contribute so far? And if you have any question, please post your question.
Well, I just like to add a few points with regards to a strategy for getting ready for this exam.
Yeah.
There are some candidates who make the mistake of thinking that when you have the notes and then you read all of the notes, you are ready. But the thing is that you need to have regular practice with other candidates who are in preparation as well. You need to
Mm,
set you need to set a timer for 8 minutes and do random stations as much as possible before your exam. I think this is the only way to be ready. If you don't have that practice under the time constraints, reading
mm.
all the notes is really not going to help that much. So that's the importance of trying to get, if you can get into an academy or have other colleagues with which you do regular practice. So I think it's very important to do that.
Yes, I think many of the candidates they waste a lot of time and reading and reading and reading. When we see the outcome, the final outcome is a robot, and they start just transcripting what they read in the notes, which is
Mm,
really bad.
yeah.
So again, guys, I did the plan myself. I did MRCS myself. I trained both of them. Okay, it is not about any academy. I don't want to advertise. I keep saying I don't want to advertise the academies. However, I personally believe that there is a huge role of the academies. Okay, not mine only, but the other academies as well. Okay, if they stop working, because many of the doctors, most of the doctors don't know the cultural differences and the approach that you guys need to take. Um, I think the result, overall result, will go down to ground. So academies have very important role, and they do help a lot. Okay, regardless of whichever academy you go to, but make sure that you make the wise decision and join the academy as soon as you can, because this is very high stake exam, and then the competition is getting worse and worse. Okay, in regards to passing, getting the dates for the exam, then passing the exam, then finding a job. Okay, quickly, time management during the preparation, create a realistic study schedule. We have talked about all this. Developing the clinical communication, practice active listening techniques, learn to explain medical concepts in simple terms. This is one of the challenge again. This is where the IMGs can lack. They don't know how to explain headache. They don't know how to explain migraine. They don't know how to explain multiple sclerosis. They don't know, many of the time they feel challenged how to explain the side effects of medications. So you need to make sure, or need to know how you can make a clinical information simple and absorbable for the layman, and you should be able to explain them in their own words. Okay, what they can understand easily. improve non-verbal communications, use of your hands, gestures and stuff. Okay, use of the pictures, diagrams, that's very important. Then practice empathy and cultural sensitivity. Empathy is something that is extremely important for every single scenario. So you guys need to know what is the sympathy and what is the empathy. And feeling the pain of the patient is actually the empathy, but you need to go into that phase. So you need to have that feeling of what the patient could have or going could be going through when they have any problem like the medical issues or other issues related to the health. Role play various patient scenarios and stuff. Mastering the orchestration types. Okay, so these are actually the major part of your assessment. History taking stations, a physical examination stations, practical skill station, data interpretation, where you have you've been given the data, the blood results of a patient or biopsy result of the patient. So these are important scenarios where you will have to communicate with the patient, and where you have to incorporate all the skills which are needed. And then the communication skills, purely the communication, like explaining or talking to the angry patient, talking to unhappy relative, talking to a difficult colleague. So those are the communication challenges that you may come across in the GMC exam. All right. Okay, final week before the exam, focus on your weak areas identified in your mock examination. So always, if you are planning your mock, you must have at least, my suggestion is 5 days to 1 week gap between your last mock and your exam. So don't do the mock just a day before. Review common OSCE scenarios, practice time management and full length simulations. Ensure that all required documents like your passport or any other document, the email confirmation and stuff, everything is ready. Your tickets are printed and you have your booking. Okay, you have not put the wrong postcode or the address. Okay, so you're sitting on the right train and everything. Just 2 months ago, I had a candidate who unfortunately, there are two centers for the PLAB, and she went to a wrong center. So one is a square and the other one is a street. So instead of going to square, she went to street, and then she had to leave and she was late for about half an hour. uh, so she was in tears. Eventually she passed, but do not make, because the anxiety and the pressure, exam pressure, can take over of your actual personality and damage all your preparation. Okay, just keep yourself ready for this exam and just plan beforehand. All right, exam day tips: arrive early and well rested, sleep well, bring required identifications in the documents, whatever the GMC says, stay calm and focus between the stations. If anything goes wrong in one station, make sure that you leave that there. Every new station is a new patient and new situation. Just take them afresh. Listen carefully to the instructions at each station. If there's any special instruction, read them properly, manage the time effectively within each scenario. Okay. Post exam steps, what you need to do: first of all, think after you come back, reflect on your performance. What do you think? What went wrong? What went right? Okay. Then plan your next step. Many of the doctors, before, they used to travel back the same day or maximum a day after. But now it is becoming very important that you find some clinical attachments and you start your working in here on the clinical attachment. And that is nowadays considered as a UK experience, and nearly everyone, about 99% of the doctors, or I must say nowadays, since this COVID, 100% doctors have clinical, or they are trying to get the clinical attachment, and you will be competing with them. So you need to start applying for the clinical attachments and stuff in advance. Stay connected with us and explore more career opportunities in the UK. All right. Any questions so far? Raise your hands. Before we take any courses, do I need to know majority of the background? No, no, you do not need to. I don't know who asked this question.
Sorry,
Uh,
excuse
yeah,
me.
yeah.
I asked, my name is Ismail. I don't know if it is seen in the screen, but yeah, I asked from Turkey,
All right, okay.
and
They connect to
there are
us.
lots of information, medical,
Yeah,
but and I am worried that I cannot remember all things because um, we just don't have so much information, and we are
मुझे तो इस सबसे बुरी काम बर्तन
sorry,
धोना
we
लगता है
are
इसीलिए मैं रखती हूँ हमेशा अपने बर्तन धोने के लिए कोई पर्स
yeah, okay, yeah. So I got your question. Dr. Mike, do you want to answer? Let's
Um,
let's try to answer his question
yeah,
together.
so if I got that correctly, his question is about how
Not
much.
knowing a lot about the medical management.
Yes. So it depends on the strategy you choose. If you want to join an academy, there is not a lot of background information you need to know because the
मेरे
academy
पे
will
नहीं
provide you with notes and then with classes where we teach you, how to be ready for the exam. So there's not really a lot of background information you need to learn before coming to an academy.
all right.
Yeah. So it is more about now. No, let me tell you. Try to explain this. PLAB 2 is more about delivering the information, whatever you have, or the treatment or the management, whatever you know, safely, and getting the right help on right time, and try to do as much as you can in the patient's best interest, and try to involve the others as well. So you need to know your limitations. Not all the time you know the exact treatment of the patient's problems, but you need to know what my limitations are and how this can affect the patient. Keep the patient in the center, and how you can help the patient, maybe by seeking help from your seniors, from your team member, from another specialist. So these are the important points. So and most of the time, honestly, you do not need a lot of information. It is just a basic information at your level. Say for example, you don't need to know what's the exact management of subarachnoid hemorrhage, but you must know that what the symptoms that the patient is describing are suggestive of subarachnoid hemorrhage, and this is a clinical emergency or the surgical emergency. The patient cannot stay at home. The patient should be seen by the senior. This is what you need to know. That's the most important point. You don't need to know about the embolization, EVD insertion, the surgical procedure, or the coiling and the clipping and stuff, which are essentially the um, uh, detailed or definitive management steps of subarachnoid hemorrhage. So, with the limited knowledge, you will be working at FY2. Okay, so you need to show your competencies and the understandings of FY2.
All right, thank you.
Okay, you're welcome. Any more questions, guys?
I would just like to add that these points that Dr. Rashid are telling, they are really golden points, and not many people will tell you from the other academies. And we being not only the examiners, we are also PLAB Guide Academy candidates, successful candidates, me and Dr. Saad. So we were like, we had some experience from the other big academy, and it was a really worse experience, no individual attention. But I'm glad again. I'm feeling like I'm a PLAB, candidate.
All right. Now there is a question, very interesting question from Mayev, if I pronounce it right. Is it possible to pass without any academy? Now, my answer to this is my answer may be taken biased, To be honest, I will try to stay honest and clear in this. Yes, you can pass, you can pass without the academies. However, um, it is not for everyone. You need to know you are the best person to decide, rather than any academy decides about you. Okay, you need to decide whether or not you need this. Okay, it's very similar to uh, to um, to buying some shoes for you. Okay, so the shopkeeper does not decide for you that you need the shoes. You go there because you feel that I need the shoes. If your shoes are fine, you never go, isn't it? So it's very very simple. Okay, just go through the requirement. If you think that your communications are excellent, already marvelous, and you are making your plans are beautiful, then you don't need any academy, to be honest. But if you assess yourself and you find the differences, the cultural differences, and you find that you realize that this exam is not an easy, this is a challenge exam. Okay, and you can fight the challenges, then all well and good. You don't need any academy. So I don't think that any academy suggests you or anyone or force anyone to join the academy, but it's a personal decision. But if you do need one, um, then do your proper work. Now, about my opinion, I have already mentioned. I think if the role of the academy goes from your journey, or most of the candidates' journey, I think the result will come down to below 50% or even less than that. Okay, it's a high stake exam. This is not about just a knowledge. It is a high skilled exam. Okay, um, you can decide about your personal needs, but do not worry about, to be honest. I know that the financial stress is one of the major deterrent that may stop you joining any good um, resource of the academy, if you feel but honestly, you will be earning 50 pounds an hour as soon as you join on any extra days. So don't worry about that, guys. So this is a high stake exam. It has its own delicacies and intricacies, and we should respect that. Okay, uh, all right. So is there a branch or center PLAB Guide in Islamabad? I wish, Amina Gilani, I wish I could do that. Unfortunately, no. But yes, we do have the candidates traveling from Islamabad, Karachi. So nearly every month, the people are going there. They're going in small groups. Dr. Saad is always there. Okay, always there to help. He lives in Lahore, and we have the campus in Lahore. Is very good and very peaceful area. Just recently, we had the candidates who went from Islamabad, as well as Dr. Sadia. She went. Dr. Durai, she was one of the doctor from your contacts, I think, and she passed her exam. She spent nearly 2 weeks in Lahore from Karachi. She went to Karachi, from Karachi to Lahore. So yes. Okay. Any any more question? All right, so PLAB Guide contact details are available. We can write it for you. You are already in our WhatsApp group, and please do not hesitate to contact us for any help that you may need. Okay, then all our dates are available on the website, and if you still have the question, again the answer is write us email or call us directly. Um, so Now we are just quickly going to go through a few more slides that is more focusing. I'm going to be focusing on your planning in the UK, like the opportunities. Okay, so if I ask Dr. Saad or Dr. Dore to take the charge, I will make you the presenters. So we can.
Okay, sir.
Are you able to see those slides of medical career in the UK pathways to success? Yes and no.
No, sir.
All right. There you go. This is a part two of our presentation, guys. Medical careers in the UK pathways to success. I really don't know how much you guys are interested in this. This is something that you should focus on and you should be fully aware. Okay. So, Dr. Saad, this is your slide. So, I will be navigating your slides. Dr. Saad
Okay.
and Dr. Dore.
Okay, sir. Okay, everyone. Can you hear me?
Yes, I can. I can hear
Yes,
you.
it's clear.
Yeah, it's clear. Okay. So,
Okay.
um,
So, basically, there are 2 years of foundation in the UK. The
Dr.
here
Saad,
slide.
I'm sorry for interruption. Are you the host? I think there is some difficulty. If you want, I can take it further. There's some technical difficulties that we are facing. Um,
Okay.
yeah, so I can take it further. Let
Sure,
me
sir.
actually talk about the medical career pathway in the UK because I'm sitting here. So, foundation program FY1, FY2, you will be after passing your GMC exam and after obtaining the full GMC, you will be considered beyond that. So you don't need the FY1 or FY2. You will be doing the exam. This PLAB 2 takes you at the same level of as of FY2, the foundation program, foundation year program 2. Okay, then specialty training, GP practice. Then there are multiple corridors that will open after for you after you passed and obtained your GMC. There's a specialty training like the general medicine, general surgery, like those kind of things. Then there are uh, the opportunities to become the general practice who are more dealing with the community. They work as a community doctor. Then the academic medicines, like if you want to go in the teaching and those kind of things. Then the public health, private sector opportunities. So there are multiple corridors that open for you. Then you decide. The best one is choosing a specialty training of the GP practice. They are easy as well as best and commonly chosen. Academics, it depends whether if you love the academic stuff, then you may come to that side, but it can be a bit of challenge. Similarly, the public health, master in public health and other stuff will be requirement. So if you have PLAB only, then it may be a bit difficult. Foundation program. What is a foundation program? It's important to know. 2 years training period post graduation in the UK. Okay, the rotation through various specialties, it has to be according to certain structure and essential step for the full GMC registration, which means that after you pass your GMC exam, the PLAB to GMC exam, you go at the you will join the GMC register near at the same level as of FY2. Okay. Specialty training, there are different ways and different training, like the run through program, for example, the pediatrics and neurosurgery, where you join in the year one and you finish in the last year. There may be the core training, like for the medical training, where you join in ST1, ST2. Then you again have to apply for the training and choose which subspecialty you want to go for. Normally, the duration is 5 to 8 years, and then eventually after the completion of training, it leads to you got the certificate of completion of the CCT, and through the competitive application. So you can't really simply apply and you get it. You need to go through certain criteria, and the filters, and take the exams and the assessment. And possibly many specialties do conduct the interviews as well after shortlisting. So this is how you can get into the specialty training. GP, again, that's a 3 year specialty training program. Opportunities for the portfolio careers, combination of the hospital and the GP placement. So in this, you work in both sides. Okay, you can work in the hospital as well as in the community hospitals. Okay, and main focus, as I mentioned, is the community based practice. Then there is a huge growing demand in the healthcare UK healthcare system. Academic medicine, again, a bit of challenge, combines the clinical work with the research and teaching. Academic clinical fellowships are available, but very few, very challenging. Okay, highly competitive. Clinical lectureships can be one of your destination if you are really fan of that and you work on your CV. Opportunities for the PhD, MD, and like those kind of thing. Potential for the professorship and leadership roles and stuff. Public health 5 year specialty training, but again another challenge, and this is one of the specialty where I don't see a lot of interest, because of the limited number of the doctors required in this sector. However, it's a 5 years specialty training focused on the population health and health policies, roles in the local authorities, NHS, government. So it can be sometimes the political stuff as well. So not much clinical. It is mainly just dealing with the policies and stuff. Private sectors, yes, there are the hospitals, private hospitals. There are not many private, but yes, there are the private surgical hospitals, like doing the operations and stuff, like joint replacements, because NHS is under huge stress. There may be long waiting. Those who have their private insurances, or those who can afford, they can go to the private hospitals as well. This is where you can find your place. They are quite comfortable places as well, if you want, but you cannot do any or join any training program while you're working in the private sectors. Now, this is very important for you all. Okay, please do ask me if you have any question. This is very important, guys, for you. Okay, I'm going to talk about the clinical attachment. Clinical attachment is an observership in the UK. In the clinical setting, means you just go and observe. Now, it has been never demanded up until the end of the COVID era. Okay, when we saw, when the UK went into lockdown in March 2021, everyone got stuck into the UK. They could not fly back to the home countries, and they had nothing else. All the exams got cancelled. They started going to the hospitals and volunteering their services to help the patients, to help the doctors, and those kind of things. This give them the opportunity to apply for the clinical attachments. This is how this all story started. Now, uh, nearly every hospital welcomed every single person, got the clinical attachment even before passing the exam. They were stuck in here. So then what happened? The people started taking the exam when the COVID bans lifted and all the restrictions lifted, and those who passed the exam uh, the GMC opened the exam opportunities for everyone who those were stuck in the UK and also from abroad. Okay, but now the time made the difference, because both communities, both kind of doctors started passing, but those who were stuck in the UK, they had clinical observership or the clinical attachments on their CV. They all got the jobs, so which created an anxiety among those who passed their exam but didn't have the clinical attachment, and they started rushing for the clinical attachment. Now the situation is nearly every single doctor need a clinical attachment for any kind of job. It is not mandatory, but theoretically, but it has now become mandatory on the CV, because your competitor doctor who is coming for the same post, same job, who has passed exam, they will have their clinical attachment on their CV. And the clinical attachment nowadays is considered a UK experience. Okay, so those who are planning, this is why planning to come to the UK, planning PLAB 2 is extremely important. Okay, so if you want to come to the UK, it is not only about passing the exam, it is also about getting a job, not just going through all the financial stress and the difficulties that you face from traveling and coming to a different country, uh, from different culture, everything. You need to get the job so that you can step into the UK. So clinical attachment is nowadays essential. Okay, it is unpaid primarily for learning and experience to get the UK experience, opportunity to understand the NHS working culture, and valuable for the CV and the future job applicants. Okay, uh, when to look for the clinical attachment now, today, after you finish this meeting, you should start looking for the clinical attachment. Start searching 3 to 6 months before your desired start date. Okay, today is the time. I suggest you all, after you finish a meeting, take a cup of tea, think about what I suggested, and start looking for different hospitals and start applying for the clinical attachment. Consider timing post PLAB 2 and pre job application. Align with the specialty interest if possible. Say, for example, if you want to be a surgeon, you might want to get the clinical attachment in any surgical specialty. Okay, going to any specialty, like if you want to be a gynecologist, having a clinical attachment in the ENT may not be considered very good choice. Okay, however, if that is the only choice that you found, then it will still be good, it will look good, but it will look even better if you want to be a gynecologist and you've done gynecology attachment. Okay, if you want to be orthopedics and you have done clinical attachment in orthopedic ward, that will look really good, and that will increase your chances of getting the job in the future. Okay, consider UK peak holidays periods, avoid if possible. Okay, so you need to make sure that you do not come in the this peak holiday periods, because everything goes very expensive, everything goes crazy. The tickets and the flight and the rents and everything goes on the roof. Okay, so just be careful about that. But if you have the money, okay, and you're not bothered about that, you can choose any time, really. Okay, how to secure the clinical attachment? Directly contact the NHS hospitals, different trust, utilize your professional network and alumni, means your seniors, your fellows, your friends, ask them to help you, ask their hospitals, ask their any email addresses. So you need to be actually trying to hunt. There are loads of hospital, but you need to find out where you want to apply. You look for the information about getting the clinical attachment. The alternative name for this is observership. So it's the same thing, clinical attachment or the clinical observership. They are the same things. Look for different specialties. You can approach to the consultants and the head of the departments directly. Just write them CV. It should be a good letter. Okay. Explain to them what you want to achieve from this clinical attachment and when you want to do, and tell why you want to do it and how that can help you progress in your career. Okay. uh, Try to make it sensibly. Okay, it should not be just one or two lines or one paragraph. It has to look sensible and beautiful and self-explanatory for your consultant, whoever you're applying for. Okay, attend the medical conferences and networking events and stuff like that. Okay, consider paid clinical attachment services. Before, clinical attachment used to be absolutely free, but since it is under high demand, unfortunately, many of the hospitals have started offering just the paid clinical attachment because they want to control the crowd. Okay, maximizing the clinical attachment benefit. Once you find, make sure that you actively engage, not just get the certificate. You want to know how NHS works. Okay, show the active engagement, show enthusiasm, seek the feedback about what you did, and you can ask your fellows, the team member, that I want to take the history. Would you mind giving me the feedback and stuff? Okay, network, create the local network connections with you, with the team member, like the consultant and the registrars and the other SHOs working on the board, and the nurses. They are all good. Okay, understand the NHS system. So these are the benefits that you need to know, and you should be hunting for gain insight into the UK health system and the culture. Okay, so increasing the chances of quick employment, gain UK experience, attachment, locum work, and all those. Develop strong communication, language skills, stay up to date with the NHS policies and the guidelines. Okay, and try to follow them. Build a robust CV. Very good. Okay, good looking. It shouldn't be just a two-pager CV, because the CVs are here regarded. Your CV is more than half of your interview. Make sure that you write it, and you can show your fellows, you can show your seniors and someone expert to go through the CV before you start throwing the CV to the others. Okay, and prepare thoroughly for any interview if you got shortlisted. There are few strategies. Use NHS job website and other medical job boards. Register with the medical recruitment agencies. Attend NHS career fairs and recruitment events. Okay, social media, consider less competitive locations. Like if you want to go to London, that may be very highly competitive. You want to come to Manchester, again very. So maybe to start with, you might want to go to some remote area where many of the people do not want to go, and that will increase also your chances of getting the job. Enhancing your CV, again highlight the UK relevant experience, like if you had any clinical attachment, showcase any research, publication, presentations of the interest where you have done different outstanding work and stuff. Okay, emphasize the teamwork, the communication, and your abilities. Include any relevant courses. Say for example, if you want to apply for any surgical post, tell about any clinical attachment that you have done on the surgical wards, and any clinical audit that you've done on the surgical wards, any surgical skills course, like those kinds. So just try to bring those relevant things in front. Okay, tailor your CV for each application. There may be different applications. Do not just make one scripted CV or the application for all the jobs. You might need to change it slightly according to the needs. Okay, so just be careful about that. This will increase your chances of getting jobs. Interview preparation, get the help from your fellows. Go through the books and the guidelines, go through the videos. Okay, ask the academies wherever you enrolled. We tend to provide them the support. If they ask us we may just go through the typical questions we can ask them, and we can explain how to approach the interview questions and stuff like that. Okay, we do that many of the time for our affiliated students and the candidates. Alternative routes to the UK, I really don't want to talk about that. Okay, but these are just a few things. Let's not worry about them. Locum work, okay, after the full GMC registration, because it is not your destination. Then the trust grade positions, clinical fellow roles, and those stuff. Okay, so you might want to in the first place try to get into that training post rather than just becoming the hospital doctor and stuff. Okay, so these are more related to the hospital doctors. I don't think that after doing everything you would volunteer for the role in the healthcare system. Maybe partially, but not fully. Okay, CPDs, attending the courses and all those, try to get the certificates and collect them so that you can show GMC. Every year you will go through the process of appraisal, and every 5 year you will need a revalidation of your GMC registration. So for the appraisal, you need to have certificates, the CPDs, continued professional development, where you prove that I've been involved into, or I've been actively working on and stayed connected with the clinical stuff, which are helpful for my continuous professional development. So you need to show them. So get the certificates, courses, attend the courses, e-learning, all those kind of things. Navigating to the UK medical system as an IMG. Before I continue talking, I just want to see if there is any question that you want to ask. Um, I'm sorry, this has become very extensive meeting. There may be a lot of information that you are going through or taking. It may be difficult. We will try to. We are just. This meeting is being recorded. We'll try to make this meeting available for those who have missed, and who have any question. If you want to go through the important pieces of information that we discussed here, we'll try to make it publish as soon as we could. Okay, there is a lot of information that we are trying to cover today, so you may not take. Raise your hand if you have any question as I go along and talk about those slides in different areas. Please raise your hand or raise your questions in the chat. Okay, just a few more slides to go through before we say goodbye to each other. Okay, navigating the UK medical health system as an IMG. Okay, it is again the challenge. This is why we are sitting together. Okay, understand NHS structure and hierarchy. You need to know what can be done in the GP setting. You need to know what can be done in the district hospitals. You need to know what can be done in the community. Okay, so you don't want to be silly and appear nonsensical when you start admitting the patients in the GP practice where there is no way to admit the patient, because those are GP settings. The GP clinics are not the hospitals, the wards. Okay, so what we see is those who are not aware as about the health system, they start, when they are given any scenario in the GP setting, they start admitting the patient. When a patient comes with a headache, they start saying, okay, I will do your CT scan, I will do your blood test, I will do this and that, but without realizing that they cannot do that in the GP setting. For that, they need to refer the patient to the tertiary care hospital or the bigger hospital with all the resources. Then familiarize yourself with the UK medical guidelines, like be aware of the NICE guidelines and stuff. Okay, but you do not need to memorize all of them. You need to be basically familiar. Learn about the appraisal and revalidation process. I just talked about that. Appraisal is that getting the acknowledgement every year that you are not just now doing the locums only, or running after the money, or after coming to the UK you are just living your life, okay, going to the pub, club, and dancing here and there, and running away from the medical life, okay. So you need to you need to do the CPDs, a continued professional development, and you need to show one of the appraiser from your hospital, the nominated appraiser, that I have been actively involved in those activities to keep my skills alive, as well as enhance my skills, as well as acquire new skills, so that my competencies match the requirement of the GMC, as well as I'm a safe doctor. So you need to go through the appraisal process every year, and you need to have revalidation of your GMC registration after 5 years. Okay, so in the revalidation, your hospital will tell, yes, we have seen this doctor, he worked with us for 5 years, and we are aware that he has been in touch with the medical profession, and his brain is not rusted, and he is up to date. So we suggest you to we support his revalidation. We suggest to please continue his GMC or her GMC as before. Okay. Otherwise, if you do not get the recommendations, you may lose a license of the GMC. Okay. Every 5 years that happens. Stay informed about the medical challenges and the regulations and stuff, any change in the policies and stuff. Seek support from the IMG networks and the mentors. Okay. So come to PLAB Guide if you want. Last slide eventually. Key takeaway for the medical career: start planning early, stay informed, network actively, and build professional relationship. That is very important. Continuously develop your skills and the knowledge, okay. And stay yourself, be yourself. Do not try to be anyone else. Do not start copying the things, okay. You don't know, there are many things happening wrong. Unfortunately, all those this internet and online stuff opened many corridors for the sports to reach the hands appropriately. At the same time, um, it has opened the doors for the thieves and the spammers as well, okay. Just be careful. UK guidelines: gain the UK clinical experience by getting the clinical attachment. So as I mentioned to you, just after finishing this, take a cup of tea. If you're hungry, take your meal and start looking for the hospital, okay. Even while you are waiting for your PLAB 1, regardless, whenever and whatever the result comes, you will still need clinical attachment after passing PLAB 2. So today is the time, while you're waiting for your PLAB 1 result, today is the time to apply for the clinical attachment. Okay. Be flexible in your initial job search, and make sure, if you don't want to be surgeon, does not matter, but you might want to step into the NHS. So even if you find a job in the on the NHS portal which is surgical, and you wanted to go to the A&E but there is no job, just simply apply for that. Be flexible for any sort of job as a doctor, okay. And preserve success often comes with the patience and persistence, and this is what we are looking for. And please let me know if you have any question before I say thank you, everyone. Oh my god, it was tiring, guys. I don't know if this benefited, but I want a real appreciation if you felt that this was a good presentation and we managed to guide you. Guys, Dr. Saad, Dr. Dore, and Dr. Mike, please put your words forward. Hello?
Yes, sir.
Yeah.
Okay, so
It was a
my,
lot of talk, man.
yeah,
It was a
yeah,
lot of
that's
talk
true.
for me.
That's true, sir. That's true. It was a lot of talk, and a lot of information has been given to the students regarding the PLAB 2 and regarding the GMC, NHS. You have covered almost all the things that they need to know even before appearing in the PLAB 2 and after the PLAB 2, what they need to do. I think they
I
are
think
much aware.
there were quite a few candidates, participants, and many of them have left. I think they started applying for the clinical attachment. They were in a so rush.
That can be one of the possibility.
I told them just wait for me to finish and take a cup of tea after that. All right, okay. This clinical attachment has become the nightmare
Yeah,
for people. Okay, and that's one of
true.
the ill-planned area nowadays that we see. When we see many of the candidates, they don't know what to do after. They just simply take the flight and go back.
Mm.
All
So,
right.
sir, my advice to them is that as they are waiting for the PLAB 1 result, so right after the PLAB 1, they need to understand the academy, especially which academy they are going to select, because it is very important for them. Because if academy is giving them an opportunity to practice and giving them personal feedback and personal attention, it's my advice to them is that they should go for that. Because if they are thinking that, oh, 1,000 or 100 or people are going to one academy, and they because people go where they feel that they should be, a lot of their friends are going, they should select that. But my advice to them is that it can affect your career, so please make a wise decision. Please make sure that you are
Yes, guys. Yeah, that's very good point. Yeah, so you don't want to get lost in the crowd. Okay,
yeah,
so come in the right place and come in the safe hands. And of course, Plague Guide is the best place.
that. So
What
sir,
did you say, Doctor Dore?
Yes, doctor,
Yeah,
exactly. PLAB guide is the best, I would say. In
yeah.
fact, I would never ever forget the Siemens scenarios and the Siemens sessions taught by you. We used to say you father of Siemens.
Thank you, thank you.
Yeah. Yeah. So, in fact, I have attempted this exam twice previously, but there were so many points taught by Dr. Rashid himself that we never knew those points. And because the thing is that this is the big thing that Dr. Rashid told, that people who are teaching PLAB 2 in many other big academies, they have not even worked in the NHS themselves, so they don't know what is the reality or what are they expecting. That is the biggest point. Because even when Dr. Rashid was teaching the subarachnoid hemorrhage and thing, the points that he told, that knowing and telling the facts regarding clipping and all the surgical procedures is too much to tell. You don't need to tell that much of information. We didn't knew these points at that point of time. Like we used to cram like we used to be a cramming machine and a robotic consultation. That's what
Yeah,
they
that's
don't
true.
want.
That is
Mm.
very true. To be honest, I don't want to take all the credits, but I think I still deserve it. Being one of the doctor working in the NHS, I think we learn a lot, and we have a lot to teach and tell. So those who have not seen any patient, real patient, they cannot really tell you the exact challenges that GMC wants to see. The overall outcome that they produce is a robotic approach, and just go inside, say this, okay, you will say this, he will say this, okay. So we don't do that. We try to make them a natural doctor and the real doctor. um, I think that's very important, because you don't want to just lose your nerves when you see a better challenge, a better twist in the approach, the GMC exam. So I think this is really a very balanced exam. If you know the approach and if you know the facts, it is very easy and very doable, very good exam. All right. Okay, Mike, are you still here?
I'm I'm still here. Yes.
Okay. Guys, I think this is now nearly the end of the session. We are hitting nearly 2 hours of continuous presentation. So please share your feedback, and if you benefited, please let the others know. We will be doing more meetings and everything in future. We started PLAB 1 as well regularly. Okay, so if you like this presentation and the meeting, tell the others to join to get more benefit. Okay, and just stay connected. I wish you best of luck on behalf of our PLAB Guide team for the future. All right, so someone said kindly look into the queries. Okay, can we get clinical attachment after passing PLAB? Oh yes, yes, you can. You can get. So you need to start applying now. Okay, you need to start applying now, and tell that you will be coming whatever any tentative date that I will be coming for the for PLAB 2 exam in January. So I want somewhere. Okay, so once you get an agreement from the consultant, it may take up to 2 to 3 months for you to even start. So what the people are doing is they get an agreement and approval beforehand before they come to the UK. And when they come here, you will have to go through the process of recruitment. It is not actually the recruitment, but you still need to do the documentations and other things. So you might need to visit the hospital wherever they are offering you the opportunity. What if the people who are already in the UK? Yes, yes, those who are already in the UK should apply. Okay, again, if you start applying now, you may not even get the reply for months. Okay, so don't hesitate, and there is no way that you will get the reply within 1 or 2 weeks, unfortunately. Okay, so you might need to apply for clinical attachments in 20 hospitals in 20 different places, 30 different places, even to get one response. Okay, so do not simply assume. Start trying trying your luck today. Okay, it's not easy, it is becoming more and more difficult. Okay, so the sooner the better. Okay, so I think we should say goodbye to everyone. uh, is a clinical attachment paid? Paid from your perspective, I mean, you might have to pay, but hospital never pays. There are few hospitals who are offering free clinical attachment. Now there are few who have started the paid clinical attachment. Even the paid getting a paid clinical attachment is becoming difficult. What is the ideal time to join academy before the exam? So you should join as soon as you get your result and you make your plans, but you need at least a month or 3 weeks in the UK. If you're lucky and you're sitting in Pakistan, you can go to our Lahore campus and you can shorten your stay in the UK, where you need at least 1 month of active interaction within the academy atmosphere. Does a paid master degree help in getting an attachment and last later a post in the NHS? Um, Master degree is master degree, so it can be helpful. It may appear beautiful on your CV, but there are multiple factors that will play a role in helping the interview in deciding your possibility of the candidacy. So make sure that you do not simply rely on the degree. There are the skills as well which are required. Then the communication skills, how you present, and what your competitor um, has in their CV, so that also matters. Yes, having something, whether this is a clinical or academic, will be helpful. All right. Any other question, guys?
Sir, one candidate is asking the PLAB Guide Academy where to join.
Oh, okay. Okay. So, PLAB Guide Academy, you can join online. Um, yeah, so these are the contact numbers that you can see. You can join online um, through our website. Okay, if you are in Pakistan, we have the collaboration with the Park Medicine Academy, which is in Lahore. So we share the campus in Lahore. So then you can contact the Park Medicine team, or you can contact us. You can pay in Pakistan to Park Medicine. That will save you the hassle of buying the pounds and those kind of things. This is mainly for the Pakistani doctors, but the internationals can also join us. Our courses are multiple courses, and they give you multiple accesses and multiple different type of enrollments. We do offer group of 5 and group of 10 discounts. Normal course prices are nearly the same as any other academy, but those who come as a group, there is always, we look forward, we welcome them and offer them the support, and of course a discount. uh, so normal course price, I just want to tell you just about the full course, which is £600 normal course price of the fee. Those who come as a group of 5, they get the discount of £50 each, then which means that they can join for 550. And those who come as a group of 10, they can enjoy £50 more discount, so means that everyone would pay £500 for joining us as a group of 10. And our courses, this full course gives you unlimited access, no further payments, anything. You can go to Pakistani campus, you can come to UK campus, unlimited time up until you pass your exam. Okay, that's a beautiful thing, and we offer just a continuous support before and after your exam as well. Okay, I think we are done with this meeting, and it was pleasant. It was lovely to see you all. You guys stayed there, and you guys listened to me, watched, and kept this interactive. Uh, I really love it. It was beautiful, guys. Okay, so um, stay connected. My name is Dr. Rashid. If you have not, if you joined me later, so I'm the director of PLAB Guide Academy. Today we have Dr. Mike. He is from Nigeria. He is one of our tutor, Dr. Duresh. She is at the moment in Pakistan. She is one of our tutor, Dr. Saad. He is in Lahore. He is also one of our tutor, and we had Mr. Rashid Sardar as well. He is our very dedicated sport and team member. Okay, I thank everyone, to those who organized as well as those who stayed in this meeting. Thank you,
Thank you.
and best of luck, guys.